I didn't want to go to the hospital. I mean, who wants to spend their time there? But I never guessed there'd be so much cool technology.
I get it. No one looks forward to a stay in the hospital. One of my priorities at St. Joseph's is implementing technology in patient rooms that helps enhance the overall patient experience and make information easy to access for doctors and nurses.
Right next to my bed was a tablet. It could do everything. If I was hungry, I could call up the menu to see snacks or order a meal for later.
Getting that right on the back end required several upgrades within our current infrastructure to allow us to manage both the apps and the technology that powers them. It wasn't easy, but it's worth it if it helps patients like Max.
What's even cooler is the tablet's connected to a really big TV. I could see all the movies and shows available to watch. They even had apps and video games I could play. It was like I was finally being in charge of the remote. That definitely made me feel better about being in the hospital.
Our goal was to make the apps fun and easy to use so patients can feel more relaxed about their hospital stay. But that was certainly challenging to make happen. We were able to get creative with storage using a hybrid of virtualization and cloud. This ensures easy, secure access to all apps and information to help make patients like Max feel more at home.
There was also this cart. There was a screen that could call up all my x-rays right there for the doctor to see. It was so cool to see what I looked like from the inside. The doctor said she could see all my health files on what's called my electronic health record. I'm young, but wow, I have a lot of files in there.
Our recent upgrade to the new EHR helped us track all those files and lets clinicians focus so much more on patient experience. And it even connects to our patient portal that Max and his family can access at home to view his hospital records, get test results, and even set follow-up appointments.
The hospital even had an app that I could download to my phone. I could watch these videos about my injury and read about why I was there or what happens next.
To make the hospital app accessible to Max, it took a lot of back-end work, but the enhancements paid off by helping us better meet patient needs.
It turns out my doctor needed to talk to other doctors about my ankle. She video chatted with a specialist on the other side of the country who talked to me and my parents to decide what to do next. Kind of like teleporting on Star Trek.
We upgraded our telehealth technology this past year. It allows real-time telemedicine consults and video messaging so specialists in other locations can still weigh in on care.
Even the plastic wristband wasn't so bad. It was even kind of cool when they scanned to make sure it was me. And then they scanned the pills I needed to make sure I wasn't allergic.
Our latest Med ID system ties into the new EMR, which can compare wristband data with patient history to help prevent medication errors. To ensure it works at an optimal level, we added and reconfigured wireless access points to keep signals strong.
I asked the nurse, who makes all this technology work? She says the IT department. How cool is that job?
How cool indeed. My IT team and I get to use the latest technology to help make our patients more comfortable and happy while they're here.
For more information on how to get the right technologies up and running to attract patients and help make their stay more inviting, contact CDW Healthcare today or visit the Patient Data Management page on cdw.com/communit. Enhanced Patient Engagement by Cisco. Orchestration by CDW.